Hello everyone and welcome to this VisionX webinar. Today we are delighted to have with us Adil El Mafthouhi, a specialist in ocular imaging and exploration. He practices at the Centre Ophtalmologique de Rive-Geneva in Switzerland, as well as in the Institut Parisien d'Ophtalmologie in France. As an international speaker, he's also an author of numerous scientific publications and university lecturer. Adil is a recognized expert in ocular imaging. He's actively involved, for example, in the development and optimization of various imaging technologies in ophthalmology, particularly OCT, and contributes to clinical research in areas such as medical retina, glaucoma, and low vision. Today's topic is essential for optimizing indications in refractive surgery and premium IOL. OCT, Optovue Solix, and topography. Understanding corneal asymmetry induced by dry eye syndrome. Dry eye syndrome can lead to remodeling of the corneal epithelium, affecting keratometry and corneal topography, which in turn may impact the accuracy of postoperative outcomes. With the multimodal capabilities of the Solix OCT, including epimapping and corneal topography, it is now possible to track these variations and enhance patient management. Today, Adil will guide us through these concepts, supported by clinical cases. We will also take some time at the end of the webinar, classically, to answer your questions. For this, please use the chat section on the right-hand corner of your screen. Adil, thank you again for being with us today, and the floor is yours.
Hi everyone, my name is Adil El Mafthouhi. I'm from Geneva, Centre Ophtalmologique de Rive, and Paris, Institut Parisien d'Ophtalmologie. I'm an ocular imaging specialist, and it's my pleasure today to talk about my experience with the Solix platform, and especially the corneal asymmetry analysis with the Solix. The last development of OCT allows the possibility to analyze and identify the epithelium layer front of the cornea and gives the possibility to obtain a mapping of epithelium. The last development, especially with Solix Optovue, allows the possibility to obtain a very wide corneal topography and epithelium mapping up to 6 millimeters with 9 and up to 10 millimeters with the Solix platform. And with the adjust scale, you can detect the very slight changes of the epithelium, especially in the area of 7 and 9 millimeters. In the past, I tried to propose a classification of the severity of the dry eye based on the epithelium mapping. In a normalized, the epithelium mapping, it's a slight uniform. We know that the epithelium thickness average is approximately 50 microns. And when you have a slight scene of the dry eye, we observe an hyperplasia, suggesting an autoregulation mechanism between the tears and the epithelium. And after, we observe a trophic thinning of the epithelium in a moderate dry eye and in the severe dry eye, probably due to the increase of blinking and probably another process of apoptosis. We already published a paper in a British journal, and we made a correlation, a good correlation and relevant correlation between the epithelium mapping and the breakup time, and we observe the tendency of thinning, of epithelium thinning when you have a very severe dry eye. We know this hyperplasia is already found in the mice model, in a model of the dry eye of 7 days, already published by Fabiani and all. And the most likely hypothesis that the dry eye syndrome induce an increasing of a cytokine inflammatory, and we know the cytokine pro-inflammatory is involved in cellular proliferation and keratinization. And look, here is before and after the dry eye model in the maps, and we observe also an hyperplasia in this dry eye stage. In my daily practice, we observe this hyperplasia in the same area of the first break of the tears. And look here, we can make a comparison about this hyperplasia. The first time, in this case, with a small point of keratitis. It's approximately always in the same area, and sometimes we can occur hyperplasia in other location depending of the chronic disease. And look here, with an IBUT, you can make a correlation, and look, the first rupture of the tear film occurs in the same area of this hyperplasia, like you can see in this epimapping of 10 millimeters performed by Solix. We have a very good repeatability and reproducibility of the epithelium mapping, and especially in this hyperplasia observation. And look, this is the same patient with a different acquisition under 2 minutes time, and you can remain and observe the same hyperplasia between each acquisition. We can control and measure this hyperplasia with a slab of OCT en face and confirm the presence of this hyperplasia and confirm it's not an artifact. And look here, we can measure the epithelium and confirm here the thickness of 71 micron in this case of hyperplasia beneath the apex, and proportional to the meibomian gland dysfunction, as in this case with the presence of the telangiectasia. And look here, the quality and the reliable B-scan and slab confirming this hyperplasia observed on epimapping. So we can manage the dry eye patient with the epithelium mapping, and look, in this case, you can observe the incomplete blinking, and the high frequency of blinking is correlated with the severity of the meibomian gland dysfunction, and also with the short breakup time, and with the importance of hyperplasia, more pronounced on the left eyes. And you have a very nice correlation between all these exams. And the correlation between the epithelium and the mammalian gland imaging is clearly mandatory associated with the corneal topography. And look here, this is the before and the after the treatment of the dry eye with the warm compress and the tears. We observe the reduction of this hyperplasia and a normalized aspect of the epithelium with the increasing of break-on time and the decreasing volume of the meniscus tears observed here and performed also with the best scan with the Solix. We know now the Solix platform is a multimodal platform. You can also measure the meniscus tear film, but you can also perform the mammalian gland imaging to analyze the stage of mammalian gland dysfunction. And look here, this is a beautiful picture about the different stages of the MGD. Another cases of the dilation of the mammalian gland and the atrophy of the mammalian gland performed and captured by the Solix. And you can also perform the color photo to analyze the level of inflammation in the lid. And we can use the epithelium mapping like a screening before the orthokeratology, because when you have a patient, a young patient, like in this case, 11 years old with a history of the grass allergy, we observe mammalian gland dysfunction, and look in epithelium mapping, we observe an hyperplasia. In this hyperplasia, it's completely proportional due to the severity of the mammalian gland dysfunction. And it's very important to analyze the epithelium before ortho-K to be sure to have the best keratometry before to begin the treatment of this young patient. And look, we know that during the orthokeratology, we observe an instability of the tear film, probably due to the accommodation associated with the inflammation from allergy. And look, another case of epithelium mapping and allergic condition. Again, we can observe hyperplasia on the inferior part, and this hyperplasia is more pronounced to the mammalian gland dysfunction. And look in the right eye, we observe the telangiectasia, more pronounced as compared to the left eye. So it takes sense that this hyperplasia is completely linked with the ocular surface disorder. We know that the effect of ortho-K is due to the epithelium thinning. And this suggests that the variation of epithelium thickness can induce variation of the keratometry. And look here, we observe this thinning aspect centered on the aspect due to the ortho-K therapy. And look the comparison with corneal topography. So it takes sense that epithelium mapping be an important part of the multimodal dry eye screening by the OCT with normalized ETM, meniscus film analysis, mammalian gland imaging, and total pachymetry. And look here, another case of multimodal dry eye imaging with associated with the EMPHAS OCT. We observe an instability of the lipid component of the tear film associated with the thinning of the epithelium, associated and correlated with the level of mammalian gland dysfunction. And look here, we can see also the sign of the conjunctival chalasis. So we can have different information with a multimodal approach with the Solix platform, with the total pachymetry, epithelium mapping, EMPHAS OCT, and the clinical finding. And look here, in case of the scleral show with a keratitis, correlation with EMPHAS OCT, and hyperreflectivity, and the correlation with epithelium mapping and hyperplasia. And then we can also manage the dry eye patient with epithelium mapping and the clinical exam. And look, in this case with the patient already performed the treatment of the BLEFX and highlight IPL session. And look here, we observe a normalization 5 months after of the epithelium mapping, and also the increasing of the breakup time. And sometimes the epithelium mapping can be a nice biomarker to improve the subjective sensation observed by the patient, because sometimes the breakup time is the same, because it's completely operator dependent on the volume of the fluorescein, dependent of the operator, and epithelium mapping can be a very nice biomarker to improve the slight improvement feels by the patient. Another case before and after EPL with the increase of the breakup time. And look, this is before, and 4 months after, we observe an improvement of the epithelium shape 4 months after. And look, another case with IPL with a very severe mammalian gland dysfunction stage 4 with telangiectasia, and this is before and after, and we also an improvement of the epithelium mapping. So it takes sense that the epithelium remodeling can affect probably the keratometry. Another case of the patient with a dry eye after refractive surgery. You can observe the scleral show more pronounced on the left eye. We know we can observe hyperplasia proportional to the degree of the ablation. And look here, this is before and this is after. It's very surprising, the normalization of the epithelium profile after the treatment. And it still remains a question: what is the role of a dry eye about the regression after the refractive surgery? So we know that the tear film and corneal epithelium are closely related. And now we know that the dry eye syndrome can cause variation in keratometry, refraction, and we can produce instabilities of the vision. But corneal epithelium hyperplasia is also a compensatory reaction to the corneal curvatures changes, as in certain pathologies like keratoconus of radial keratotomy. But and you have to distinguish the hyperplasia due to the dry eye and hyperplasia due to other aspects like keratoconus, and we have always utility to compare epithelium mapping with total pachymetry and the stromal mapping, and also with the mammalian gland imaging. Look, in this case, we know that in epithelium mapping, you have a pathognomonic aspect of the keratoconus with the thinning of the epithelium mapping above the cone associated with the hyperplasia donuts around the cone. This aspect is already published 10 years ago by Dan Reinstein with Artemis. And look here on the right eye, we observe a very pathognomonic aspect of the keratoconus, and we can confirm with the corneal topography. But in the left eye, we observe an hyperplasia. We know that the keratocone population has some problem of allergy and ocular surface, and sometimes we observe an hyperplasia inducing a mask effect of the keratoconus. And here we observe a first keratoconus. That's why you have to compare the epithelium mapping with the total pachymetry. We observe a decentration of the distribution in the total pachymetry. And with the stromal pachymetry, we observe a decentric distribution and the thinning of the stroma. That's why you have always to compare total pachymetry, epithelium mapping, stromal mapping, and also mammalian gland imaging to be sure there is not a mask effect due to the ocular surface disorder. And look here, this is a hyperplasia of this same patient. And now we have a new display on the Solix, and you have always the possibility to have the three mapping, corneal pachymetry and total pachymetry, epithelium mapping and the stromal mapping on the same display to make a comparison between each mapping. And look here, this is a patient with a keratoconus, and you can make the comparison. Look here, we observe a thinning of the epithelium. Here is normalized epithelium mapping with a scale of 2 microns, and we can make a comparison with the thinning of the stroma. And on the left eye, it's the same thing. And you can make the comparison about the three mapping. And after, you can make also a comparison with the corneal topography embedded in the Solix platform. And this is the new display available on the new software from the Solix. And you can make this comparison between the total corneal pachymetry, stromal pachymetry, and epithelium pachymetry, and you can observe the pathognomonic shape of keratoconus, about the thinning above the cone, and donuts, hyperplasia donuts around the cone. And look here, now we can also have a multimodal analysis with this three mapping, and you make a very nice correlation about the pachymetry distribution between the whole mapping, like in this case of pellucid marginal degeneration. So we have observed the different stage of the epithelium remodeling due to the dry eye. And look here, the correlation with the corneal topography inducing sometimes of corneal asymmetry. This is the case of this young girl with a medical history of grass allergy, and this woman was a candidate to the refractive surgery. And look here, we observed hyperplasia of epithelium mapping on the both eyes. This hyperplasia is more pronounced on the right eyes, and this hyperplasia is proportional of the severity of the meibomian gland dysfunction. And this hyperplasia induce some curvature modification due to the epithelium thickening, inducing this asymmetric effect. That's why you have to give some treatment about a dry eye with a warm contrast or tears, and reproduce again a corneal topography and observing the epithelium changes in order to obtain the best keratometry in the refractive surgery or premium IOL. Another case of asymmetry with another machine, and it's very interesting that different epithelium mapping has not the same lecture. This is a case of epithelium mapping from the CSO, and sometimes the lecture of the results are very difficult. And look here, we can imagine some hyperplasia, in this case of the asymmetry. But when you perform the same exam with the Solix, it's more clear. You have a very nice level and stages of the epithelium mapping, and you can highlight this hyperplasia, in this case more pronounced on the right eye, inducing the corneal asymmetry curvature due to the dry eye. And this is the new display of this patient with a scale here of the 5 microns. That's why you have to click on the normalized ETM to obtain an adjust scale of 2 microns to highlight the small changes of the epithelium. Now, with the last software in the Solix, you have the possibility to obtain the corneal topography based by the pachymetry scan. And look here, this is a comparison between the corneal topography from the Solix and corneal topography from the Sirius CSO. and you have a very nice and reliable correlation between this exam, excepted that with the OCT you have a more precise analysis of the posterior curvature. And here the correlation between the Solix and the Cirrus, with very nice correlation about the keratometry assessment. And with the corneal topography Solix, you can make a comparison between the corneal topography mapping, epithelium mapping, total pachymetry, and stromal mapping in case of complicated cases. And look here, this is a case of the keratoconus with a posterior axial topography. And this is the epithelium mapping corresponding of this patient. And you have the new display. You can make the comparison about the epithelium mapping, the thinning of the stroma, and here the thinning of the total pachymetry and the decentered distribution, and the same on the left eye. And you can have the correlation now with the corneal topography, epithelium mapping. You can also have the anterior elevation and the posterior elevation. You can make also the small changes of the posterior curvature and compare and make the correlation also with the mapping and the stromal mapping. And the left eye also. And you can also better diagnose the asymmetry due to the dry eye, whether or keratoconus patient. And look, in this case, you can observe an asymmetry of the corneal curvature. And look here in the Solix, we observe an hyperplasia in the bottom, inducing the curvature changes. And look here, it's very clear. You can make a comparison very clearly. Another case with corneal asymmetry and hyperplasia in the inferior part, with hyperplasia correlated with the severity of the mammalian gland dysfunction. And look here, you can make a superposition of this hyperplasia on the corneal topography, explaining the curvature changes due to the epithelium thickening. And on the other eyes, the same thing. You can observe the hyperplasia and you make a superposition of this hyperplasia area directly on the corneal topography, explaining this asymmetry. And when you treat the dry eye patient, you can make the comparison between before the treatment and after the treatment, and you can also analyze the normalization of this asymmetry in the corneal topography, confirming that this asymmetry is induced by the dry eye. Sometimes many assistants give the eye drop to the patient before the corneal topography exam to help the acquisition of the corneal topography. But when you put the eye drop on the eyes of the patient, you induce a thickening of the epithelium. And we know that the epithelium mapping is based by the different refractivity of the tear film and also with the basal membrane. And when you perform epithelium mapping, the first line will be the meniscus film from the eye drops. And look, we induce an increasing of the epithelium. And look, this is a patient. This is a before and after the eye drop installation. We performed the two corneal topography exam at approximately three minutes between each exam. And here is before the eye drop, and here is just after the eye drop, and you induce a pseudo hyperplasia of the epithelium. And we would like to know what is the consequence on the keratometry. And look here, when you put the eye drop installation, you induce an increase, so a modification of the astigmatism of 1 diopters. It's very, very important. That's why you have to consider the astigmatism changes due to the eye drop installation before the corneal topography. And it takes sense, probably, in the future, we can analyze the eye drop persistent with epithelium mapping and en-face OCT. And look, in this case, we put the eye drops, and we can analyze and measure the changes, the epithelium changes back to the initial stage. And probably in the future, we will have some study based on the epithelium mapping and the clinical exam. So, in conclusion, we know that OCT provide excellent visualization of the surface of the eyes with the epithelium mapping, and you can observe the remodeling of the epithelium varying with the different stage of the dry eye. We have to compare the epithelium mapping with the total pachymetry, stromal mapping, and also meballic gland imaging. And now we know that the epithelium examination is clearly crucial to achieve keratometric accuracy, especially in the context of the refractive surgery or premium lens or torics, in order to obtain the best keratometry. And thank you for your
Thank you very
attention.
much, Adil, for this thorough presentation, which actually helped us out to understand corneal asymmetry induced by dry eye syndrome. So I see that we already have several questions in the chat. Maybe I should start with this one. So basically, it was very interesting to see that the installation of eye drops can distort the full interpretation of corneal topography. So what other precautions would you recommend before performing an exam to avoid any alteration of the results?
So we need to check epimapping in order to analyze the level of dry eye and how epithelium can affect the corneal curvature, and therefore we must treat dry eye first in order to optimize the keratometry evaluation. So according to me, I will recommend to perform First of all, the ETM at the beginning of the consultation to have the best analysis of epithelium, independent or other installation.
Okay, thank you. Let's continue. Do you have any tips for not missing a first keratoconus due to compensatory effect of the epithelium?
Yeah, now it's really clear. The case of keratoconus screening is a correlation between the epithelium mapping, but not also epithelium mapping, but stromal mapping, total pachymetry, and corneal topography. And now it's clearly mandatory to have this multimodal analysis associated with the corneal topography. It's inseparable.
Okay, thanks. When do you recommend performing an epimapping in a patient's evaluation process?
It's simple. So now I recommend to perform epimapping for each corneal imaging screening.
Every one of them.
Yeah.
Okay, clear. All right. Um, you also talk about this one. The breakup time seems less reliable than the epimapping for monitoring dry eye. So, what would be the minimum set of exams that you would recommend?
Yes, of course, breakup time is operator dependent and also depending on the fluorescein volume. Sometimes dry patients feel an improvement of their symptom, while breakup time is still remains stable, but epithelium thickness showing changes. That's why it's very interesting to monitor dry eye patient associated with a clinical exam and also with epithelium mapping. And currently, I will recommend to perform epithelium mapping, mammography, because I think mammography is inseparable of epithelium mapping, the measure of the meniscus tear film with OCT, with a vertical scan, breakup time, and also OSDE to quantify a subjective improvement.
Okay, fair enough. One last question, I believe that we can take just to make sure that we're on time. What are the advantages for you of having epimapping and topography on the same report?
Correlation between this both exam and also the stromal mapping enable to explain certain corneal curvatures irregularities induced by dry eye, but also by other conditions because we know that the hyperplasia can induce the curvatures, induce the hyperplasia of the epithelium is sometimes a reaction of the curvature changes, and it will be nice in order to perform the refractive surgery with safety and to be sure it's not a first keratoconus.
Okay. Thank you, Abel. That's the last question that we had. So we are reaching the end of this webinar. So you still can ask actually your questions to Adil about this webinar on contact@visionx.com. And also you will receive the replay of these whole sessions in few minutes. So again, thanks Adil, again for this
Thank you.
great
Thank you so much.
presentation. Thank you all for attending this webinar. And stay tuned actually on our social media and on visionx.com for next webinars. See you soon.
Thank you.